Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a Lisfranc injury. Number one, what is a Lisfranc injury? So before you can get to that, you kind of need to understand the anatomy of the foot here. You got the metatarsals and you got the midfoot area, which includes the cuneiforms and the cuboid. So the medial cuneiform, the one on the inside right here, has a joint to the second metatarsal, to the base of that second metatarsal, that's called the Lisfranc joint. And that joint sits right in this area. So a Lisfranc injury would be an injury to that joint, to the ligament that crosses that joint. And typically what happens with that is it will actually spread out. You'll get dislocation across that joint. And so sometimes what will happen is you'll get everything staying except those all move over. You can get where you actually get a fracture at the base. All those can actually be a Lisfranc injury. But the point is the location and what's happening there. So number two, why does it happen? It's actually a type of injury. It's a type of sprain where you actually sprain that ligament. So when you sprain an ankle, you twist the ankle, you tear the ligament, and the ligament allows additional motion that it didn't allow before it was torn. Same type of thing happens here. So when you step on the foot spreads out, sprains that ligament, and you get pretty significant discomfort, pretty significant pain in that area. And what typically will happen is it's notorious for not healing. So you'll walk for a little while, really sore for 2 to 4 weeks, and then it starts to get better, and then you'll step funny on something and it will start over. And that's if it gets better at all. Some people, they just continue to hurt their midfoot, and they're doing x-rays, they're doing all kinds of things, and they're not seeing anything wrong because they're not looking for that dislocation of that joint. And so because of that, they actually start to limit that. Then you don't realize that it's actually a Lisfranc injury. Number three, what can you do for that at home? There are not a lot of things you can do. If you have a boot, you have something where you can actually immobilize it. That will help the pain. Ice will help the pain as you decrease the swelling. Anti-inflammatories will help the pain, but really nothing's going to fix it without going in and getting it treated. So if it's hurting enough and it's interfering with life, you go in and get it evaluated. And there's really two options. You can be put in a boot or a cast for a long period of time with the hope that it will heal. Most of the time it does not. Or you can actually go in and do some type of surgery to actually treat the Lisfranc joint area. Typically the way I treat these, unless they're pretty significant arthritis or pretty significant fracture, is you can run a wire across it. I'll show you kind of where the wire goes from here to the base of the second metatarsal. It crosses over that joint and it creates it stable. It's got a button on either side that pulls everything together and keeps it stable so it doesn't hurt. So Lisfranc injury, it can be pretty problematic. It can be season-ending injury for a lot of athletes. So it's something that you should get evaluated and be seen, because there's not a lot you can do for it at home. It's Dr. Brandt Gibson, and this is your Podiatry Tips Day 187.